So what do you find most rewarding about being a GI doctor?
Um, that's a very broad question, but in terms of GI, GI for me is like the perfect marriage between medicine and surgery. Um, Obviously, as a gastroenterologist, you're an internist first, and there's a very sort of cerebral, deep thinking component of internal medicine that, you know, attracted me initially. But beyond that, a lot of what we do is hands-on stuff. And so GI is a very procedure-oriented field. Um, and, to that end, the therapeutic maneuvers and, procedures that we do often can give like real time, relief for patients. So, GI for me offers kind of the best of both worlds in that sense. There's that kind of didactic side, but also the procedure-based side, gives me a wide variety of experiences that's been quite rewarding for me. So, I've had a wide variety of experiences where I have tried to learn to maintain equanimity under duress. And so with those bleeders, a GI bleed, someone who is, unstable and, they're circling the drain and they really need us to address that acute issue. Sometimes you get it right and sometimes you don't. But, in those situations, I feel like I'm pretty solid in being poised, keeping my composure, thinking critically, not being rattled very easily, keeping your cool when everyone else around you is kind of losing it. Because if you do, that doesn't help anything. People are looking at you as a physician and the leader of the team, to take control of the situation and also obviously, hopefully use your skill set to the betterment of the situation and help that patient in front of you. So I think I'm pretty adept at doing that. I've spent time in the military and seen trauma and lots of other things. So not that it's easy, and it's never easy. It's always daunting. I mean, don't get me wrong, I'd be lying if I didn't say that I was nervous in those situations or, had worry. But in the final analysis, you have to act, and you have to act decisively, and you have to do it in a, confident, coherent manner that people around you have confidence in. Because if your team doesn't have confidence in you, then the whole thing's going to fall apart. But certainly just in terms of helping that patient, you have to be able to steady yourself. And yeah, I had a professor that used to talk to me all the time about equanimity under duress, and it just resonates with me in those situations. So I think I'm pretty comfortable in those when those opportunities present themselves.
That's good. Yeah. That kind of leads into the next question I had, which is, what do you find most stressful about your field, and what are some ways that you found most effective in, handling that stress or overcoming it?
Yeah. Again, a lot of the presentations are acutely decompensating patients, and that's probably the more stressful. The bile duct stent scenario we were talking about before, palliative maneuvers, you can take your time with that. If you're not successful, you can, pull out, game plan, redirect, approach it another way. But, when someone is decompensating rapidly in front of you, and, that code is seconds away from happening if you don't, if you aren't successful, that's very daunting. That's challenging. Yeah, so that's probably the tougher of the two scenarios. And yeah, and again, both are rewarding, but the challenge is being able to accept the things that you can't control and control the things that you can. I kind of say that serenity prayer in the back of my mind all the time. God grant me the serenity to accept the things I cannot change, the wisdom to change the things I can, and the courage to know the difference.
Yeah.
Or the wisdom to know the difference, or however it goes.
Yeah.
But that's what it boils down to. And, I just have to have faith that in the moment, I'll remember those things and remember my training and, be able to get the job done.
Yeah, for sure.
Yeah, well, I think everyone has to have some mechanism for resiliency, be it their faith or their family or, meditation or prayer or whatever it is. I think that's crucial to being successful in whatever you do, particularly in medicine, because there's a lot of pressure and it doesn't stop. And, you have to have ways to cope and to rejuvenate yourself, to rejuvenate your spirit, your mind, your body. And I think faith for me plays a big role in terms of that. And it's something that, you need to continue to, or at least I found that you have to continue to explore and really intimately engage with in order for it to have meaning. And so it's a dynamic thing. It's not just this is it, rigid sort of thing. You have to continue to interact with that and interface with that so that it's fresh and has meaning and has real tangible application for you. Otherwise, I find that, when you need that to lean upon in terms of your professional life, it doesn't have as much benefit.